This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. This week's episode of The Vault focuses on charities that are providing mental health care in regions of the world in significant crisis. Delphine Gardère is a resident of Haiti and heir of Rhum Barbancourt, Haiti's prized, historic, and award-winning rum. Delphine joined the podcast remotely from Haiti to tell us about her work as CEO of Rhum Barbancourt and her role as chair of the Barbancourt Foundation, a charity which provides mental health and healthcare to the community in Haiti.
Having this massive widespread insecurity that's affecting everyone. I don't think there is one person in Haiti right now that is sheltered from insecurity. You have armed gangs that are basically deciding what is the law and what is not the law.
I met Delphine at an event with the Congressional Black Caucus last year when members of the Caribbean American community came together to address the crisis in Haiti. That same month, I met Julia Minkevitch. She is a medical student and serves as the executive director of TeleHelp Ukraine, a nonprofit committed to delivering essential medical and mental health assistance to Ukrainians affected by conflict.
We recognized as medical students and PhD students, we don't have the money to support them. We don't have the license and the experience to physically go there and help patients. But we do have ourselves and our brains and our knowledge, and we do have a computer.
We discussed the Haitian and Ukrainian crisis and how these organizations have been able to support countries and communities in crisis, and how you can become involved too. So thank you so much for being on the podcast today, Julia.
Thank you for having me. I'm very excited and happy to be here.
We met at the Psych Congress in Nashville, and it's so interesting because I was presenting on postpartum depression and you were next door presenting on your work in Ukraine as a U.S. medical student. And my mind was just blown. So tell me about your work and your organization.
All right. So the organization that I serve as the executive director for is called TeleHelp Ukraine. So it was started in April 2022 by Stanford medical and computer science students. And essentially the goal of our organization is to provide free, quality mental health and medical specialty support through telemedicine to those affected by the Russian invasion. And so at the Psych Congress, what our goal as an organization was to show what were the most common chief complaints within our mental health telemedicine clinic and what, these patients in Ukraine and Poland were facing due to the effects of the war.
It was so interesting because people in the United States, they often feel paralyzed when things are happening abroad. And often we feel like, well, it's happening there. What can I really do? But here you are, along with other medical students, actually creating change in the world, and you're not even flying there. How did your organization even set up that infrastructure?
So we utilize a telemedicine platform called Clinico, and that's where all of our appointments are held. And we also utilize different communication platforms like Viber or WhatsApp or Telegram to communicate with patients. But mostly, everything we do is because of a team of very impressive, remarkable people like software developers, medical students, legal team members, where everyone just kind of came together and whatever their specific expertise was, they went out and handled that portion of the organization, and everything essentially just came together online through the computer.
The thing that struck me about your organization and how you did it was I know that other doctors during the Psych Congress came up and asked the same thing I asked you, like, how do you do that? How do you get involved and help people and you don't put your license at risk? How is this okay from a medical legal standpoint? And you were just like, oh, our lawyers are on top of that. Explain how you're able to do that.
Essentially, we do have a legal team, and we do not provide medical malpractice insurance. And the reason why we don't is we just believe that the cost of that would outweigh the benefits. There are Good Samaritan laws present in Ukraine, and we also have an agreement with the Ministry of Health in Ukraine and Poland, where our organization, our physicians, they're not able to provide official prescriptions, but they are able to provide recommendations for the patients. And so while the risk is never zero, it's very, very minimal. And it pretty much just comes down to what you're comfortable with and what you're comfortable with saying to a patient and helping a patient. But really, in reality, a lot of these patients, they don't have access to medical or mental health care. So they're just grateful to have anyone to speak to. And especially, we have phenomenal physicians who are like phenomenal physicians. They specialize in amazing things, and they really do help our patients. Yeah, that's how we do it.
So, and you were explaining to me that, like, let's say there's a physician, because I know several physicians came up to you during the Psych Congress and they were like, how can I help? And I think one even came up to you and said, I'm actually Ukrainian and I've been living here for 20 years and I want to help too. And you were explaining that if a patient is in Ukraine and they use this service, they speak to, let's say, a psychiatrist who's here, and the psychiatrist isn't providing the treatment, but the psychiatrist can talk to the primary care provider who's actually on the ground in Ukraine, or a urologist or a gynecologist, whoever is left in that community, because you don't necessarily have a psychiatrist there to give recommendations. And that provider, who's on the ground in Ukraine can use those recommendations to treat the patient. Is that correct?
Yes. So when patients sign up on our booking platform, we ask them who their primary care provider is, what physicians they see, and their phone numbers, so that we can contact them if needed. Unfortunately, because of the escalation of the Russian invasion, a lot of these physicians have left the country, and so a lot of these patients are the ones that have received care for years for chronic conditions. They kind of have nowhere to go. So we try our best to form relationships with physicians in Ukraine and on the ground. And if there's ever a case where this patient has seen a neurologist, for example, for years, and now she doesn't have one, we kind of ask for their previous medical documentation. We ask for their previous medications and any other information that they can give us so we can help them continue that plan.
Wow. And how did you come up with this model? Because I had never heard of a model like this. And I'm sure there are many different countries around the world who could benefit from this, especially I do a lot of work with some Haitian organizations. And I know that in the state that Haiti is in right now, there are many doctors in the US who want to help out, but they don't want to risk their lives going back. So how did you even come up with this type of model?
There are many organizations that go on the ground to other countries, and we recognized as medical students and PhD students, we don't have the money to support them. We don't have the license and the experience to physically go there and help patients. But we do have ourselves and our brains and our knowledge, and we do have a computer. So initially our model was that we wanted to provide face-to-face medical consultations for those whose physicians have left the country and they're in dire need of answers. So if they need to ask questions about their medications, if they need to ask questions about their labs, or if they're even presenting with something that they aren't sure is an emergency, they can ask our providers, like, do I need to go to the hospital? Can I wait? Can I do this? And so we wanted to create a organization where everyone can volunteer from the comfort of their own home. And that way, also patients are safe and they don't have to physically travel to the hospital or physically travel to their physician unless it's necessary. And so they can take comfort in the fact that they can receive care at home, because a lot of our patients do live in areas that are very unstable and dangerous. And so we wanted to give Ukrainians the options to stay in Ukraine and stay in Poland and still get the care that they deserve.
And what are some of the things that you found in your study? What were some of the findings that were being reported in terms of the mental health of the patients that your organization offered aid to?
So we have a research team, and we went through hundreds of treatment notes, of mental health treatment notes. And what we found was similar to everything else that's in the literature on the mental health conditions of those going through humanitarian crises. So, for example, the majority of conditions or the majority of chief complaints that our patients had were anxiety, depression, and PTSD. However, we did also find that a lot of our patients felt very lonely and isolated and kind of stuck where they were. So we actually used our research project to start offering group therapy so that patients can have that feel where, you know, there's other people that are going through something similar. There's other providers that are willing to help them, and just so that they feel that other people in other countries are supporting them and behind them, because it can be very difficult day to day when you're living the same reality and like losing people that you love, losing your day-to-day connections and your day-to-day interpersonal relationships can be difficult. And so that's what we found as an organization, basically.
And you're a medical student right now. You are dealing with the stress of having to pass your boards, meeting your clinicals, all of the requirements. And on top of that, you are working to help people who are in like really intense positions of trauma. How do you, as a future doctor, take care of your own mental health when you're exposed to so much pain and so much trauma, not just in your current hospital, but from what you're seeing through your organization? So
I would say that the first year was really difficult because I was interpreting for psych appointments. I was also going through treatment notes. I was also communicating with the patients one-on-one. It's kind of an internal battle where I need to focus on my studies, but I also want to help people because these are the people in my community, you know, like these are friends of my family members. I think the way that we all kind of debrief and think about what's going on and kind of sit with our emotions is that we lean on each other in our organization. So anytime someone is having a difficult time and they need to talk, we usually set up meetings where we both work. What I try to do is I try to focus on the positive impacts that we have, and I try to kind of come to the reality that you can't help everybody and you can't help every patient, no matter how much you try. And I've gotten better with, as long as I'm able to do ABC, you know, one little thing a day or two little things a day, that's still making an impact and that's still improving somebody's life in some way. So our patients are very sweet. Their testimonies are great. They're very grateful for us. So that always helps as well. But I would say like leaning on each other, talking to other people who are going through the same thing. Definitely there's strength in community. And when you share and you don't bottle it in, it helps you because you can validate each other's experience and offer support. And, you know, with regards to what you're seeing in these communities, you mentioned group therapy has been helpful. What are some other things that have helped some of the patients you've supported using this organization? There is mental health carries a stigma in lots of countries, especially Ukraine. And I think what's very, very strong about our organization is that our patients from our medicine platform, so whether these patients are seeing a cardiologist or oncologist or dermatologist, when our physicians or interpreters or even case managers recognize that patients might be struggling mentally, we always offer them the option of booking a mental health appointment with a provider that best suits their needs. And so I think that's one of our strongest things is that we are all in-house. So if somebody is struggling with, for example, OCD and we have a specialist, we will send them over to them. If someone is struggling with a certain chronic condition in our mental health clinic, then we'll send it over to a different physician. So I think that the biggest thing that we've seen is that we kind of help break down the stigma for patients because we're showing them that many of our patients go to both clinics. It's all confidential. No one has to know. And it's your choice if you want to utilize it or not. And fortunately, we've helped a lot of patients that way that have never done therapy before or have never seen any kind of mental health provider before. It never ceases to amaze me that even people who are like in literal war zones
will deny the need for mental health. And listen, we all have physical health, we all have mental health, but we shouldn't just assume that people are ready to talk about their trauma. In fact, one of the symptoms of trauma is not want to talk about it. You want to avoid talking about it because you're afraid that if you talk about it, you'll break down, or you're afraid of the physiological discomfort, the heart racing, the breathing fast, the muscle tension that comes along with it. So, I'm so glad that you automatically offer your patients that, even if they're coming in for like chest pain or they're coming in for back pain, you're doing that mental health checkup. And I think that that is where we should be moving in medicine as a whole. When it comes to your generation, I find that, from the research, I'm learning that younger generations are more about mobilizing their communities. There's this notion of no one's going to be left behind. I'm not going to enjoy success if my entire community isn't enjoying success. And I'm finding that a lot of people in your generation are finding purpose in these type of ventures, right? Like, what would you say to someone who's feeling purposeless, who's around your age, who's just like, there's so much going on in the world. It kind of gets me down. It paralyzes me at times. What would you say to motivate that person to find purpose and meaning?
I would probably ask that person, if they were in someone else's position, what support would they want? And what support do you think would be the most helpful for them? And I would probably sit down and brainstorm and think about what organizations can offer that. And another thing about TeleHelp, which I love, is that it is truly student and volunteer run. Like, it is the first organization that I've been a part of where if you have an idea and you have the means, it can happen. So a lot of our volunteers, they're able to do what they set their minds to. If they have an idea for a project, we can get it done. And it's great meeting people like that, because now it gives me a much brighter outlook on life, because I know that in the future, if I have certain goals, I know there are people out there that'll help me reach them. So I would pretty much tell someone, if they're feeling helpless, there's always something out there. You just have to push, and find the right person, find the right people, find the right organization. And no matter how helpless, or no matter whatever you do, like, let's say you work a 9-to-5 desk job and you feel like you're useless. You're not. I can promise you that, because every single role in our organization, no matter what they do, is extremely important. It's a domino effect, and it trickles down to the direct well-being of our patients. So I would say, like, don't put yourself down. I understand feeling helpless. There's a way out there, though. And there's always a way you can help. You just have to go for it.
And from what you're saying, it sounds like your organization does not turn away any skill set. It sounds like it's like, hey, you have legal expertise, we'll take you. Medical expertise, we'll take you. Tech expertise, we'll take you. Communication skills. So, whenever people think about a medical or a mental health organization, they think, well, I don't have, what it takes for that. Oh, I'd love to do that. But you don't realize that these organizations need someone in every skill set. They need anyone from clerical to maintenance, right? So in any way that you can help, you can get involved. What are ways that people can get involved and to support your organization and your cause?
So anyone who is in the medical field, obviously that's the first thing we'll talk about. If you're a physician, nurse practitioner, nurse, medical student, you can apply to volunteer on our website in a variety of teams. So even if you don't want to volunteer as a provider, or let's say you speak Ukrainian and you have a good medical Ukrainian foundation, you don't want to translate notes, you can also volunteer on teams such as like fundraising, social media, research, etc. I really do mean that there is a position for everybody. Our organization, what we've tried to do over this year is kind of dispense information for patients so that it's accessible for anyone who has Wi-Fi. If our patients will benefit from, let's say, a infographic on wound care, we want them to have that. And so we need people, even if you're in high school and you may not want to do medicine, but you still want to help people in some way. We need people to, make these ideas happen, think of things that will help people, help translate them, help get it going. So just apply on our website. If you're not able to donate your time, we always appreciate monetary donations. We did an analysis and essentially $10 goes straight to like a full medical appointment. And none of us get paid. So yeah, we do. All of our money goes directly to the patients. So at least you know that your $10 will go directly towards an hour of someone expressing what they've been having difficulty with.
And where can people sign up? What's the URL they should use?
Our website is telehelpukraine.com, and there's a little button on the top where you can click I want to help, and then it'll show different ways where you can help and different ways you can volunteer. So
that's telehelp, like HELP.
Mm-hmm. Yes.
Where can we find you and follow you and support you?
So we do have an Instagram, telehelpukraine.com. We have a Facebook page. We have a Twitter. We have a LinkedIn. It would be great if we can get more followers, more support, more volunteers, even those who are just interested in our model and maybe interested in creating a model that's similar to ours. We'll appreciate anything. So Instagram, Facebook, LinkedIn, our website. I think that's pretty much it.
Followers matter. People think, oh, followers not a big deal. It's a big deal. Followers translate to support, both community support and financial support. It can uplift an organization. It could spread awareness. Followers really matter. So we'll do our best to support you. And thank you so much for coming onto the Vault and for all of the hard work that you're doing, the meaningful work. It's really inspiring. And I really hope that people are moved by this and moved to action. Thank you so much for coming onto the podcast today, Delphine. It's such a pleasure to have you on.
It's a pleasure to be here with you as well. I've been a fan for a while.
Thank you so much. And I first met you last year at an event with the Congressional Black Caucus. And I was truly blown away by what you were saying on the panel and how you were speaking to the trauma and the collective experience that's happening in Haiti. And you're one of the people who actually lives there or is there frequently, and you understand what most of us, we don't have access to. We may read a news article here or there or see a news clip, but you understand the experience because you are there so frequently. So I'm so happy to talk about these issues with you because I feel like people just become so numb to pain that's happening in the world, and people just stop talking about these issues. But it's important to talk about them so that there's awareness and there's support. So I am so grateful to you for being on the podcast today. And I would just wonder if you could just take us into a window of what's happening on the ground in Haiti, because many of us don't know. We don't know what's going on.
Since March, we've had a change of government, which has led to us being cut off from the world, but also having gangs taking over basically the country. There's a lot of not only political instability, but also the current crisis is really about, is about having this massive widespread insecurity that's affecting everyone. I don't think there's one person in Haiti right now that is sheltered from insecurity. You have armed gangs that are basically deciding what is the law and what is not the law. And this has been very, very tough. They actually shot at an airplane a couple of months ago. And this is how they basically decided to shut down the airport. They have also impacted the ports, making it very difficult to go in and bringing merchandise in and out, so leading to major disruption in the supply chain, from getting anything from water to medical supply, and even the fact that we're not able to move around freely means that even kids are not able to go to school right now.
Wow. It's devastating. And there's so much trauma. And I just wonder, What are the mental health supports there? Are there any? What are people focused on? Because it's hard to think about mental health when your basic needs aren't being met.
It's already something culturally that's quite taboo. People don't necessarily seek out mental health counseling easily. You'll often see people act out and things like this, but they're not necessarily self-aware that there is an issue. And also because of the lack of infrastructure, there are hospitals, but they are in very bad shape. And actually one of the gangs actually looted one of the biggest hospitals in Haiti recently. There are a few programs, but they're very, very scarce, and it's not something that's easily accessible.
And it's also something that is hard to focus on when people need food, they need water, they need protection, they need education. And I remember at that event where I met you, there was a sense of helplessness, and people here want to help. They just don't know how. In your experience, what has been, or what are some of the most effective ways that people who are not in Haiti can support the people in Haiti?
I think right now there's been a lot, I think NGOs have done a lot of work in Haiti. But today, I think the major point would be to help Haitians rebuild themselves and finding a Haitian solution, but helping them, accompany them within finding that solution. And that's, I think, the toughest part, because you don't want Haitians to become overly assisted, where we've seen sometimes aid flow flies in and then disrupts local economy. But maybe reinvesting or helping local businesses, investing local entrepreneurs. And I think maybe with the international community and the diaspora, maybe help with first reestablishing the rule of law. So stopping impunity and feeling that some people are finally going to be accountable for, their actions. And that goes with the helplessness, is that you feel that it doesn't matter what's going to happen because no one ever gets punished.
Mm-hmm.
So,
that is the truth.
Yeah. So why would you go and change things? And that's just the way it is, and move on. Yeah.
And you bring up entrepreneurs, and you are an entrepreneur. And when I think about the strength, the skills, the perseverance it takes to run a business in a place that is constantly in crisis, I just think, wow, that is remarkable. And you were telling us about how you have so many people that depend on you. It's not even an option. What are some of the strengths that you have leaned on to continue leading one of the largest companies with so many employees and to support basically communities that are in crisis?
So I'm thankful because I have a really, really good team. I have a 600 people team. Part of it is really always being aware of what's going on and listening. I think I can't stress that enough. Listening is really one of the key of going through it, and leaning into each other as well. So we have a security team that helps the teams feel safe when we have to go into work. We try to work from home remotely when we can, and we try to find all sorts of creative strategies to cope with ever-changing security situation.
And also as a leader, working in a situation where you're constantly having to process your own trauma and then be there for others and helping your team and your employees and your staff process trauma, that is a challenge. How do you even approach that? What do you do?
Yeah, I'm not going to lie. I think there's a lot of self-care that's involved in this, because if you're not taking care of yourself, you can't lead other people, and you obviously cannot take care of others. Self-care is the first thing. It's also being aware about your boundaries, about knowing when you need to process information and when also you want to cut some information away, doing triage on the information. That's learning how to do that. And I have to say, sometimes I'm good at it, sometimes I'm not good at it. But also having the team around you keep you in check sometimes when they realize, maybe you need to take a break or maybe you need to take a step back here. I think that's very important if you have people like this around you. And yeah, as a leader, I think that's the best way. And it's also about showing the team that you're involved with them, that they're not on their own. We're collectively doing this. So trying to lead by example to whichever extent that you can, I think is really important, especially in a time of crisis.
And how do you talk to your team and the people in your organization about things that are taboo? Because as a leader, talking about stress and trauma and knowing when to say no and take a break, that can be challenging, right? How do you talk to people who may not necessarily identify with words related to mental health or may not want to acknowledge it? Maybe their coping mechanism is to just push through and be numb. How do you help people who may have very different ideas about self-care and wellness? How do you help them to make sure that they are staying healthy, to make sure that they are taking care of themselves?
When we started having the insecurity issues, I think it started really being really problematic in 2021. We actually started doing a few workshops where we talked about coping mechanisms and breathing exercises and just little things about how you can take a 5-minute break, like a 5-minute mental health break during your day. And we started incorporating that in the corporate culture slowly and always trying to keep in check with the employees, our colleagues, just trying to see, is there something off with them? If there's something off, really addressing it. And try not to make mental health a taboo. I try to bring some vulnerability to my team. Obviously, I can't give them all of my emotions, but telling them, I feel like this today, or this was really scary, like putting a label on it. And because a leader is also a human, people tend to forget this. And I think that's really important, is just labeling your feelings and also showing them in a secure way that it's okay to talk about it and we can talk about it. And when some things happen, we address the best way to talk about things. Like, for instance, if there was a shooting in the area, we have to talk about it and we have to address it. In February, we had gangs that actually burnt our fields. So
I'm so sorry.
Thank you. And the first thing was to actually address this directly with the employees so that they understand exactly what's going on and be very honest as well, because it's also for their safety and transparency, open communication, and also try to get some feedback as well, as much as possible.
Yeah.
Yeah.
It's so important to be honest because people know when you're hiding things and that makes them feel less safe. And as leaders, we don't always have all the answers. Sometimes we could be grappling with something very difficult. And if we just listened a bit more and we learned from other people, we'd get to a solution a lot quicker, and a solution that actually works and is sustainable. I'm glad that you did bring up that the way to support Haiti is to support business owners. People think that, okay, let's send a bunch of aid. Let's send a bunch of resources. Let's send a bunch of money, but not that aid doesn't always go into the right hands. And without infrastructure and without a country, you have.
We've seen this with the earthquake.
Mm-hmm. Tell me about that.
I feel like there's a lot of disbelief with all the money that was funneled in through NGOs and different international governments to rebuild Haiti after the earthquake. And today we wonder where a lot of that money went. because we don't see the infrastructure and we don't see the infrastructure. We don't see where did it go back into the Haitian economy.
And if it does, and I feel if you're not putting the money into the actual people, the businesses that are going to stay there, that are going to keep the money in the community, then you're not going to see it. You're not going to see stability, because there's no reason to create stability if there's no sustainable wealth. And we often think that, oh, it's about, okay, let's send doctors over, let's send all these things. Yeah, you still need that, but you also need a future. A country needs a future, and it needs it to be their future. What are the other things that you wish people knew about Haiti that we just don't know because for some reason we're not getting the coverage? Maybe it's not considered to be an important population for news outlets, which is wrong. But what are things that we don't know because we're not there? What are things that you see that we should know?
There's a lot of things. I think Haitians are, well, as like we're very resilient people. I think a lot of the Haitian therapy goes into a lot of arts and crafts, and you see a lot of that get funneled into this as a coping mechanism. So that's really, really interesting. And it brings, I think that's one of the best things, the brightest things that I love. I was listening to an interview of someone a couple of months ago, and I think what struck me was how they talked about fostering reconciliation between Haitians. Because even though there isn't necessarily issues of wars like you had in Rwanda, civil war, genocide, and based on race or race and other like religion or anything like that. There's been really, really like decades of impunity. You've had the Duvalier era, which went unpunished. Then you had the era of Aristide, where we were under embargo for a few years. And then you had 2003, 2004, where you had actually the first gangs to come out, which were called the Chimères. And then you had the earthquake in 2010, 2011. And then the last decade, you've had the issue of some of the money that, from Petrocaribe, which was the money from the Venezuelan fund, which were not invested into the economy, or that we don't know whether they were invested in the economy, if I want to say it politically correctly. And it's difficult because you live with this collective trauma constantly, and you have people that are on different sides of the fence, whether you were under the Duvalier era, or that person was from that part, or that person's aligned with this political faction. And there's never really like this reconciliation of thinking, we need to think about the future now and move forward. And moving forward is that people become accountable, that we decide on a common ground, that this is no longer acceptable, and this is how we move forward. We're doing this plan with A, B, C, D over 10 years.
I think that's so interesting that it's hard to make progress when there's unspoken or very spoken dividedness. And there is strength in numbers. If people are united, they can achieve way more. That's so insightful. I always ask my experts to recall a time in their lives when maybe on the outside things look great. Maybe the business was thriving and they were doing what seemed to be the impossible, and everyone was just like in awe of them. But they knew inside, they knew they were struggling. And how did they get through that? And I'm going to ask you that question.
I've had this, like I'd say several times, but I would say most recently in 2020, I gave birth to my second daughter during the pandemic. And it was after a very, very difficult time with my family. And I ended up buying out the family, like the other shareholders of the family business. And I was going through postpartum, but basically everything else business-wise, it was a huge accomplishment, a huge achievement. Everyone was celebrating this. People were asking me for interviews. On the outside, it just seemed like everything was just falling into place, and I was like a rock star sort of thing. Mm-hmm. But I felt horrible. I had gone through a difficult pregnancy, especially being in confinement. And then no one really talks about postpartum, especially in countries like here. And it's only maybe 6 months to almost a year later that I went to actually see a therapist, and when they told me, you're actually going through postpartum, and I don't think you've given yourself a break. You haven't been kind to yourself. And it just clicked that I had never actually taken the time for myself. I went back into work head on 2 weeks after giving birth and never stopped. Yeah.
And it sounds like you went through it by asking for help. And this is something I hear so many times, especially in women entrepreneurs, business owners, mothers, that they have these symptoms, but they're just pushing through. They're pushing through because you're the rock. People depend on you. Employees depend on you. Your kids depend on you. You can't let anyone else down, but you're letting yourself down. And thank you for sharing that, because when people like you who have accomplished so much talk about it, it really decreases stigma for so many others. Where can we follow you and keep on supporting you? And what are some charities that you recommend that we give to?
I have a Twitter account, Delphine Gardère, so my name, Instagram as well. We set up a foundation a few years ago where we help the whole community around Barbancourt. We treat about 800 people a month. We have a small clinic, level 1. We also do trainings for youth to keep them off the street, basketball and soccer, essentially. And we are, I think, 501 approved in the US. Another organization that's very close to my heart is HELP, which is the Haitian Education Leadership Program. And they help privileged children have scholarship to university.
Wow, that's remarkable. Thank you for all that you do. And thank you so much for coming onto the podcast today.